Our second speaker is Dr. Donald Northfelt, and Dr. Northfelt is certainly, for me and many of my colleagues at Mayo Clinic in Arizona, our go-to breast oncologist. He's the medical director of our breast clinic and a consultant in medical oncology. He's going to speak to us today about breast cancer prevention, and I will say we're trying to decide who gets the award for most often participating in these meetings, and I think we don't know what we would do with the conference without Dr. Northfelt. So please join me in welcoming Dr. Donald Northfelt.
Let's see, I just do a sound check here. I'm on my microphone, yeah, great. I wanted to point out my Twitter handle at the bottom on the right there. I don't tweet as prodigiously as some Donalds that you may be familiar with, but what I try to do on my Twitter is not talk about my kids or my dogs. I just put information about breast cancer and breast cancer risk reduction. So I've tried to keep it exclusive to actually the topic that I'm talking about today. So if any of you are interested, or if you have patients who are interested in breast health and want to check it out, I don't have anything unique or novel on there. I just retweet things that I find elsewhere. So it's not that I'm asking you to believe me, I'm asking you to believe other reliable sources that I've retweeted. So that's the purpose of that. Disclosures. So today's objectives are to identify individuals who are at risk for breast cancer, the point being that if we're going to offer means to reduce breast cancer, we need to identify who it is that needs those strategies. And then I'll review the medical and surgical risk-reducing strategies that are available. And I'll finally discuss some non-medical approaches to reducing breast cancer risk. I added a couple of background slides at the beginning. I was doing this late at night, and I got overly enthusiastic about some of this information, but it has nothing to do really with the topic. I just thought maybe on background you'd like to see this. So if you look here at the top right, there's the incidence, or the anticipated incidence of breast cancer in the United States in 2018. About 266,000 cases are anticipated to be diagnosed. And then down here you see 40,000 deaths are anticipated from breast cancer in 2018. And this imbalance between incidence and mortality has been consistent year after year after year for decades.